Cristiano Ronaldo had come off during the game against Al-Fayha with some right hammy issues, and as you'd expect, there have been a lot of questions on whether he'll be able to return to the World Cup later this year. I'm Monica, a sports physio, and in this video we'll talk through how you typically would injure your hamstrings, what the expected timeframes are to return back into competition, what management will look like, and is icing the hamstring the right thing to do. So let's try and figure out what has happened to Ronaldo during the game. So if we work backwards, we know that he decided to stop playing and sit out. And then if we go backwards, we can then see during that substitute with Al-Fayha around the 74th minute mark, Ronaldo does approach his team and it looks like he's sort of showing them and grabbing onto that right hamstring region. So we know at that moment he decided, okay, well, I'll just try to keep playing, and if it's still there and I still notice it, then I'll just sit out and won't push it. If we go just before that substitute moment, so the play just before that, we can see Ronaldo was actually on one side of the pitch and did like a high speed run and a sprint all the way to the other side of the pitch, and then is actually then kicked out with his right leg. And I'm just speculating here, but whether there was a moment in that play where he may have felt his right hamstring potentially, because literally after that, that's when he approached his team to let them know. And of course, they were quite far into the game at this point, so fatigue may have also played a role here. But we know that if there was sort of like that acute event or episode that has happened, the accumulated exposure can also be a factor. So 5 minutes prior to the event, if there was a really high workload, especially if there was a lot of high speed running, like over 21 k's an hour, that can increase your risk of getting a hammy injury. So the most common ways that you'll injure your hamstring are either through like a speed mechanism or a stretch mechanism, or you can have a combination of both of those. So with a speed mechanism, normally you will see this during a sprint, or if they're doing like a high speed run, like over 80% of their maximal speed. And typically they will feel the hamstring injury happen when the hamstring is under length during the running. And with the stretch mechanism, this can happen if the hip is up in flexion and the knee is extended, so the hamstring is under length, so it's being stretched. And this can happen in football, like during a follow through of a kick. And in terms of timeframes on returning back into competition, yes, it depends on when you tick your rehab criteria, but it's also been shown that the BAMI classification system is reliable in predicting the time loss in professional footballers. So for example, if you have a grade 2 injury, they're saying that this might indicate there's an additional 3 days to the rehab compared to a grade 1 injury. So for every increase in grade, you sort of expect to add 3 days onto your return to play time frame. And then with the letter, it's the letter C that we're more concerned about, which is the intratendinous location. The reason being is they tend to have a higher reoccurrence rate, so they're more likely to re-injure themselves, but also the rehab tends to be a lot slower and longer for them, so you'd expect the time frames to be longer to get back into play. So if it wasn't for like an intratendinous injury, most elite clubs will normally try and get a hamstring injury back within 3 to 4 weeks. Now let's go through the management of a hamstring injury, and let's chat about whether ice is the way to go for a muscle strain. And the answer for this is not really. So icing a muscle strain is actually more old school, and it's not usually recommended anymore, and I'll chat through the reason why. There is a new acronym that's out there now called Peace and Love. Peace and Love has replaced the RICE acronym, which stood for Rest, Ice, Compression, Elevate and Refer. So Peace and Love, the theory is you use the acronym Peace for the first 72 hours of the injury, and then you can use the Love acronym following this. So Peace acronym, you got P for protect, need an active recovery to help speed or to help facilitate tissue healing and repair. So if you have prolonged rest, you're actually delaying the healing process, and you're actually then affecting the quality and the strength of the tissues. You're obviously doing this within pain. You then got E, which is still elevate, and then we go into A, which is avoid anti-inflammatories, and we can put ice in this category as well. The reason we avoid this, especially for muscle strains, is because it slows the inflammatory process down too much, and we still need that inflammation to help with the tissue healing. So generally we don't recommend this anymore. I mean, unless you've rolled your ankle and you can see so much swelling there, then of course you can warrant ice to help reduce the swelling. But with a muscle strain, you just don't get it to that extent, and you actually do want a bit of inflammation to help with the tissue repair. Then we move on to C, which is still compression. So this will help to control the bleeding. And then the E is actually for educate. So you're going through with the player their diagnosis, what to expect of rehab and the recovery timeframes to get back into play, as well as managing their load. So why do Ronaldo use ice? Well, I actually don't know. But to be fair, like some clubs might end up still using ice, so it looks like they're still doing something and addressing it. But it could also be player preference. So if Ronaldo has used ice previously and it's worked well, or if he prefers to have the ice on there. I guess that's where our role as physios and health professionals come in, especially for the educate component of the acronym, where I feel it's our role to at least inform the players and the team of the updated evidence and sort of, show that there is now minimal evidence that shows ice actually helps us speed up the recovery process. In fact, it can actually delay the healing response. So I think that's where it's our role to sort of present the options and the evidence that's out there. So now going beyond that initial phase, you've got your LOVE acronym. So L being load. So with load, you're wanting to do this early and within pain. This is important because early mechanical stress helps with the tissue repair and helps to build your tolerance. If you actually remove activity, it can actually add an additional 11 days onto your return to play timeline. And we don't want to do that. O is then for optimism. And I think you also want to be realistic with this as well. So knowing your expectations for recovery. The reason we have that in there is we know that things like depression, fear and catastrophizing can be barriers to your recovery. V is then for vascularization. So you want to have some cardio in there to help improve your blood flow in the area. And then E is for exercise. You're going through that rehab pathway. And when you're going through this rehab process for a hamstring injury, it's really important to include eccentric exercises that are sort of hip dominant and knee dominant. Reason being is you want to have really good strength in your hamstrings under length, as this is commonly how they can get injured, as we spoke about earlier with that stretch and speed mechanism. And of course, you're building the capacity of that muscle, but you also got to include some reactivity and speed work into this. So including even things like high speed running and sprints to make the hamstring more resilient and try and prevent that re-injury. You also need to zoom out and look above and below your hamstring, because we know that if you've got poor strength and control in your trunk rotation, or you've got poor lumbar-pelvic control, this can actually then put more load onto your hamstrings. And it's really important to then look at the motor control, so how all your body segments are lined up with things like running, because that can then play a role as to how much load the hamstring is experiencing. And so for the final question, will Ronaldo be back for the World Cup? Well, the World Cup is in June, so he's got just over 3 months. And even if he does have an intratendinous involvement with his hamstring injury, this should give him plenty of time to try and be back for this. So I don't really have any doubt that he will miss the World Cup. Thanks so much for listening. I'm sure that Ronaldo will bounce back really well and then be able to dominate in the World Cup.